It is exactly 12:05. And Milazi boy, you on the ball. I loved the soundtrack there. It is so in tune with what we're going to be talking about with Dr. Nazeem Abrahams. And of course, it's a signs, symptoms, impacts, and effects of drug addiction. Nazeem Abrahams runs the Lighthouse on the Horizon Drug Rehab Center on the West Rand, and he's here to talk to us about all of those very, very serious issues that impact and tears apart entire families. Dr. Nazeem Abrahams, Salaam alaikum, welcome to the program. So good to be speaking with you once again.
How are you, Auntie Julie?
With your du'as, alhamdulillah. And how has COVID-19, the lockdown over the past so many months, impacted on the work you do and possibly impact on a spike in addictions, perhaps? And are you seeing more and more patients coming in?
Yes, absolutely. And the third part is there's been quite a lot of relapses. I think it's safe to say that the effects that COVID has had on the recovery process has been horrific. For one, the loss of life in family, loved ones, the loss of employment, the aspect of not having the ability to deal with these losses, and obviously just retracting back into what they know best, to numb the feeling and to alleviate the hurt and the pain. So yes, it has had a major impact on the recovering people
I'm
and
wondering
on
if
addiction on its own. Absolutely.
So, someone who's been through a rehab center such as yours, and they've been clean for quite a while, and then one of these events shakes their world. That would be a trigger for them to obviously relapse, and they go back into a very deep and dark hole of addiction all over again. What are the chances of getting them back on track again? How long will it take? And I know you're going to say it differs from person to person. It would depend on the drug of choice, etc., etc., etc. But really, the short question is there hope?
Absolutely. Particularly when I speak from the perspective of the therapeutic community, the institute that I run. I mean, our main objective and our main purpose here is to empower people, to empower them and to educate them. So even though they might be a stumbling block, they have the education. They have been empowered to be able to pick themselves up and dust themselves off. And I've seen this happen subsequently quite often, sadly said. But I think the important thing is they were empowered enough or educated enough and were strong enough to be able to pick themselves up and allowing that slip to become part of a healing process rather than just letting it overflow and stumble on into a complete negative. So hope, yes, definitely.
For someone who was doing drugs for a long period of time and then go and clean up their act, spend 6 weeks or however long at a rehab center, remains clean for a couple of years, and then relapses again, continues doing drugs for another 4 or 5 years. Is there hope for someone like that? Then they go back into rehab. And I'm just wondering, how many relapses does a person have to come to the realization I need to be clean, or there's just no hope for that person?
Obviously, my first answer would be preferably none. However, there is the reality of it happening, and again, it comes back to having the knowledge and having the tools to be able to pick yourself up, and especially lady people that has been for long periods clean, 5 years, even 10 years. And that's one of the major conflicts that you have in your recovery process, because you become comfortable. And when you become comfortable, you really just become complacent. And you start doing, and you start developing or start packing back into old habits, not necessarily picking up and using immediately. So for all intents and purposes, you find that the mental relapse is taking place, which then snowballs into a physical relapse at some point in time. To answer the question there, does it happen? Yes, it happens often. The chances of people not coming back, having the ability to pick themselves up. I can only speak for the institute that I teach in, or that I have and that I empower and educate several people. The percentage of them not being able to come back and or pick themselves up is really almost 0 to 1%. The rest would have the ability to either walk in here themselves and pick themselves up, alternatively make that call and counsel with me through a process. And fundamentally, you find that that comfort zone comes in and sets in, particularly when it comes to relationships, whether it's with spouses or with girlfriends, also with parents. If there's not a balance between the healing process between caregivers and recovering persons, then there's a gap in the relationship. And when there's a gap in the relationship, the obvious and the most saddest thing is that then there becomes a lack of communication, and there's no communication. And communication is just about talking and having a discussion, but there's no discussion, there's no communication.
But
They
Nazim,
really somewhere else.
oftentimes, and I've heard this from a lot of people, if your loved one is addicted, communication becomes extremely challenging because they are very short-tempered, they're very abusive. If you don't hear them, or if they perceive that you're not hearing them, communication breaks up. There's always a fight. What you hope to have as a nice family sit down, talk, and just enjoy some time together with your loved one, invariably ends up in a big blow up.
Yes, and that is mainly because there's a complete lack of communication or even understanding, as you have said. However, with the therapeutic community and the RPP, the relapse prevention treatment plan, we allow, and it becomes almost law, if you like, for leadership in terms of your, and leadership and guidance in terms of your aftercare or your integration process, where these meetings and this communication has to take place. And obviously, if there is a lack of communication from the recovery person, it's then brought back to us, and we have to pull this person up, and we need to identify with this person why she's coming for aftercare. It's just sad that we often find people finishing a primary care part of the program, and they have this perception that they're done with there. And that is the biggest part of your relapse structure. Rehabilitation is divided into three phases, particularly with PC. And there's a primary care, which lasts a particular period of time, with a particular treatment plan that is derived for you and a standard program to instill a level of discipline. But then on moving forward, stepping into the next phase, you're not stepping out of rehabilitation, you're stepping into the next phase of rehabilitation. But a lot of the time, and this is the saddest part, because you find parents also allowing this to take place. And they, because things is going well, and the kids look good, and it's almost like, this mashallah, that's my test trust. And that's the sad part, because you have a snippet, you have a pop-up of what can be. And if you don't follow the entire process, then it's going to be exactly just that, a pop-up. And it's going to disappear.
Oftentimes, what is very sad is the relationship between the parents or the spouses, the loved one, whoever it is that is the addict in the family. breaks down so badly that the addict has taken total control of the family dynamics. The addict actually terrorizes that family. What is it? What drives that scenario? What has gone so horribly wrong in that situation? Or is it the drug of choice that is making this addict feel all powerful and in control and is able to take such control and become so horribly abusive? I should imagine it's a type of, it should be the choice of drug.
Answers twofold, because remember we have biopsychosocial damage, okay? So from a biological perspective, a lot of institutes don't really do proper purification processes. In somewhat reasons, they talk about it not having science or scientific measures of proof that it actually works. I have proven them wrong in many different instances. And with that biological chemical imbalance that's still there, as much as you may have done psychotherapy and counseling and you've identified with certain things, you'll find that the addictive personality or the person stuck within the addictive personality disorder is still running on a false frame of mind and a faulty belief system. So automatically when things doesn't go his way, he blows up because he's still not where he really needs to be. You know, I often say, and people often laugh when I say this, like, no, Vicky Holler and Wanger, and he's looking good, and then people think they're rehabilitated, but you're not. And they get stuff so easily back, particularly when they get home and all of a sudden everything is forgiven and all good. Yes, we need to be able to forgive to move on. But where's the accountability? Where's the responsibility? And you mentioned something that I think is very pertinent for me to touch on, is the dynamics of the entire home gets ridiculed to such a point that it becomes quite serious. I mean, on both an emotional, psychological, even sometimes on a physical aspect. That is because caregivers still find it fit to take responsibility and ownership of an addiction that is not theirs to take responsibility for. And that's very important in the recovery process, to be empowered when you are dealing with the affected parties. That would be the parents and the caregivers. Now, that too is something that is really taking place in institutes. And when it does, it's a minimal of 1 or 2 therapy sessions. And people will say, yeah, but I went for counseling. You went to have a chat. You never went for counseling. You never did go and unpack. And you never did go and deal with what you needed to deal with.
So what you're saying,
those things happen.
So what you're saying, Nazeem, is that not only must the addict go into rehab, the family has to go into rehab as well. And I'm not suggesting the family physically go into rehab, but the family has to interact with the institution that the loved one is at. And they need to be given tools or skills in how to deal with their loved one when he or she comes back home.
Absolutely. Absolutely. You said a mouthful. It's exactly like that. You have the infected party, for the lack of a better word, infected, okay, by this rough and really dangerous cycle of addiction, which causes biopsychosocial damage. And then you have the loved ones, siblings, parents, family, neighbors, community at large are affected by all of this. So there has to be a healing process for both parties. Because if for example, the addict goes to rehab and he genuinely makes a change, he comes home, change hasn't taken place at home, and all you see is somebody that, and all you remember is the snippets and the pop-ups that comes up in your head with all the ugliness and the negativity, because you haven't dealt with it either as the caregiver. So your reaction becomes triggering to the actual recovering person.
Okay.
And we would often say, as therapists, we say, yeah, but you need to have coping skills and you need to be able to accept and you need to be able to understand that you caused that damage. All yes and good and well. However, I mean, with human beings, there's only so much that one can be. Imagine genuinely changing or you're working on changing, change doesn't take place overnight. So you are honestly and sincerely working on change, and yet all you're getting is being punched down all the time because of your past. So if that healing
Yes.
process doesn't take place
Mm.
simultaneously with both infected and affected parties, you got a recipe for disaster.
Okay. Tell us about Lighthouse on the Horizon. And also, we're going to talk about the different drugs, how it impacts on the addict, and how they behave in the home. What is it that the family members, I don't know if it's going to make any difference, but what do they look out for, signs and symptoms, and the type of drugs, street values, and so forth. But before we get to all of that, talk to us about your center and why is it, how long has it been running for, and why has this become a work of passion for you, Dr. Nazeem Abrahams?
Well, I think it's very clear in terms of your last question there, why it's become a passion for me is it's about giving back. It's about giving back to a society that you've helped damage for me, and that's how I read it
Oh,
and
okay.
understand it. As a recovering person myself, well, alhamdulillah, today is just over 21, going on to 22 years
Mashallah.
free,
May you
and
always remain
achieved
clean.
quite a bit in that period of time. And having said that, I think it's very important that people understand, particularly the recovery. Recovery process is not just about staying clear from drugs. Recovery process is about allowing yourself to be able to live without drugs and to sustain your life, living a healthy, ritual, and cultural life without having to, or the desire or the need to take any drugs. That's what recovery is really about. So, in having said that, a lot of giving back, whether you're participating in the mosque and in the churches or participating in the schools or participating just in family events, but you have to give back. That is part of the recovering process. And again, people far in between don't do that. They're just chasing either money and they're chasing fame and they're chasing careers and they forget about themselves and who they are and where they are. And that's where the complacency steps up and steps in. So it's very important to always have the ability or have the time, make the time, whether it's 10 minutes in a week, never mind a day, but you've got to make the time to give back because once you give it back, you are in fact remembering where you come from. And as long as one remembers where they come from, they know that they're not going to go in the same direction. They will go in any other direction but that direction because they remember the hurt and the pain and the disgust of that direction.
How long have you been running Lighthouse on the Horizon? And are you
Lighthouse,
happy with the successes that you have seen?
Alhamdulillah, Shukr. I think I can proudly say that Lighthouse on the Horizon has made a huge difference in many lives of those people that had followed the recipe. You know, I often use that as an analogy, and I ask can you bake? No, I can't bake. If I gave you a recipe and you followed it to the letter, do you think you'll be able to bake? Yes, I would. So we give you the recipe. It's entirely up to you as a person to apply yourself and to follow the recipe without changing it. And then you've got a guaranteed recovery. Because why has it become so easy? Because you are being given a recipe by persons who developed the recipe, who followed the recipe, and who've been successful in doing so. So there is no failure unless you allow yourself to fail. And that's another huge part of where my passion comes from. Because you're having the ability to give back and you're making a difference in so many caregivers' lives. You're making a difference in so many addictive personality lives that it becomes very much fulfilling.
And how long are you running?
I've established this institute in 2004 and we've been running since then.
Alhamdulillah.
And we've had our ups and our downs, some really serious ups and downs, financial struggles, and all sorts of types of struggles. But shukr, alhamdulillah, there's a philosophy that the therapeutic community lives by, and we teach this to all our students here as well, is if you do your thing right, everything else will follow. So
Absolutely.
and having said that, I think that's one of the main practices, even for myself, is the challenge
Alhamdulillah.
of being able to continuously desiring to achieve doing nothing other than that which is correct and that which is right, but also doing it because it's the right thing to do and not doing it just for the sake of doing it. That's very important.
Okay, let's look at the drug of choice that the young people are using in and around Gauteng. Does it differ from region to region? And,
Right. That does change from place to place, but it's becoming really very much common. Very sadly said, is crystal meth. Crystal meth is a drug that is formulated and that is a combination of both methamphetamines and amphetamines, which is from the poppy plant as well. And this is something that causes a huge type of damage in the brain itself. The damage of serotonin, the damage of dopamine, physical damage, damaging your teeth, your skin.
How is it ingested?
Affects your organs on different levels.
Okay, how is it ingested and how do they use it? How is it used?
Crystal meth could be snorted, could be smoked, could be injected. Those are the three very common ways where you could do it through injection, where you inject it directly into your veins. It could be snorted, made fine into a powder form, and snorted up your nose. And
so does it come in
left in crystal form and then smoked out of a crystal pipe?
Does it come in tablet form?
I didn't get that one.
Does it come in tablet form, and what is the cost? I'm just trying to give parents and loved ones an idea of what the addict is spending a day or a week on drugs.
Oh, yeah. Look, you could easily pay 150, 200 rand a bag. You could get bags for like 30 rand as well. You could get bags for 50 rand. But in most cases, you can pay up to about 150 rand a bag. And this, I mean, in cases, in full-blown cases, people are using 3, 4, 5, 6, 7 bags a day.
A bag of powder, would it be a bag of powder or a bag of tablets or a bag of crystals?
A bag of powder, crystal meth is exactly that, crystal. It's like sugar crystals. And that is in a bag. The bag's not even full, a little Ziploc bag that you can find it in, that they supply it in. And then obviously you smoke it out of a pipe, a very round glass pipe. And then obviously if you're snorting it, you just use a straw. And if you're injecting it, obviously the needle and the syringe.
What about cat? I hear a lot about cat, and I'm also hearing talk that I was talking to someone who is an addict, and this person was saying that they want to relocate to Durban because cat is not available in Durban. So what's the difference between cat and crystal meth? And if cat is not...
Here's the thing, we mentioned this earlier. Every area's got its own kind of choice of famous drug or common drug. So in Durban, we got heroin, which is called sugars, which is again a little bit worse than cat and crystal meth anyway. That's one of the reasons why they don't bother with it in Durban. But cat is also becoming quite popular there now. So that's the wrong belief they got there, or the wrong idea that they got. But cat again is very similarly like crystal meth, amphetamines and methamphetamines. But it's bulked up differently, okay? So you get ephedrine and pseudoephedrine that is mixed with cat. Crystal meth is very different, and that's cooked up more in the crystal formula, cat more into a powder formula, and bulked up with a whole lot of other stuff that is just as dangerous and what actually causes the damage on the teeth and the skin and the organs of the human body. But
When you
cat in
say,
itself
sorry,
is, in my
when,
opinion, as dangerous as crystal meth.
okay, when you say damage on the skin, what does it do to the skin? What does it do to
Well,
the
you
teeth?
find this.
How is it taken, and what is the cost? What does it look like? So people watching us this morning, it's a pity I should have asked you to keep samples and show it to the camera this morning.
I could still do that if you want.
Yes, if you have it to hand, why not?
um, crystal, as I said, you get in a Ziploc.
Yes.
Cat is very much the same in a Ziploc packet, and it's really a small little plastic packet that you find it in. Cat is more a white, creamy, powdering, very fine powder, and crystal meth is almost like sugar. You couldn't. I think the best way of explaining what to look at when you're looking at it is that it actually looks like little crystals of sugar in a little plastic bag. And cat is a creamish, whitish powder.
And cost? And what's the impact of cat?
Cost on
Apart
cat
from,
as well, depending on the quality and how it's bulked up. You can pay up to 30 Rand, right up to 200, 300 Rand a bag in different sizes.
now, we are told, in fact, after this interview, I'm going to be talking to someone in the cannabis industry, talking about the legalization of medicinal cannabis. So I don't want people to jump onto the wrong bandwagon and say, she's just had an interview with Dr. Nazeem Abrahams talking about the severity and the seriousness of drug addiction. And now she's talking about the cannabis industry. But of course, we're talking medicinal cannabis. We're also hearing talk that weed is safer or less harmful to the body, to the mind, than cigarettes, than tobacco. Your thoughts?
Absolutely incorrect. I will not advocate cigarettes in a sense that it's okay, because it's not, and that's exactly why they have signs on the boxes telling you how dangerous it is and that it kills. However, weed, particularly synthetic weed that is grown, dacha cannabis that is grown in rooms in different climates, these plants are medicated. And these plants are causing people to go into drug-induced psychotic states. And I see this every day. So when people think that it's okay to smoke cannabis, and for example, something very popular, to pop a Rohypnol, Roshi, the little blue tablet, which is a pharmaceutical drug. And this has become very common amongst our young youth. Where
Isn't that the rape drug?
Correct.
Right.
Correct.
So what are addicts doing with that?
They're drinking this and they're smoking weed, and it's become very popular over the years. Not now, over the years, and it's become more and more popular because it's so easily accessible. And
what sort of a high? Right. What sort of a high does it give them? And once they come off that high, what happens?
It literally gives you the same type of high where you go into a high or you go into a low. Okay, so if you take quite a bit of Rohypnol, you go into more of a low than a high, and rather into a high than a low, and then you take the cannabis to bring you down from the high to more of a low. And
okay,
I play around
right.
with balance.
Okay,
but
I've got a few questions from viewers and listeners. Let me just. What is it that my loved one is using that makes him so violent and abusive? And somebody else is asking, why does my loved one sleep a lot, seeming to sleep his life away? So there's two totally different scenarios here. How do I interact with my loved one without creating a big blow up?
Okay, let's start with the sleeping one. The sleeping one is obviously I go on a high and then I come in with a low. And the low then allows me to be sleepy and I might have a little bit of an appetite and I will eat, and then I'll just sleep. And then my desire is to sleep until I wake up for my next high. So hence it seems that I am now, and the reason why I sleep, because sleep is part of the process now. Because I'm fortunate enough to sleep, because I've taken a drug to bring me down. If I didn't take a drug to bring me down, I would be still up high, which then takes me back to answer the following question, the second question, which is why is the person becoming violent? Because now I'm not sleeping, I'm suffering from sleep deprivation. I've got a lot of hurt, a lot of pain, a lot of shame, a lot of guilt. I'm not dealing well with stuff. And then I still need to deal with people nagging on my head. So obviously, and the people that they're more violent with is those closest to them, unfortunately. Those very people, those very loved ones that finds it fit to take responsibility for somebody that should be taking responsibility. They act out and they're violent towards those people only, in most cases. Very far in between are those same people violent with somebody else.
Okay, and what about the addict that seems to have lost his or her appetite? They don't eat much at all, or they go through phases of eating a lot, cleaning out your entire fridge, and then phases of not eating at all. What's going on there?
That plays a very big role in the science of addiction. Okay, so the science of addiction is very clear. You have your high, you have your low, and the different effects that it has on the serotonin levels and the dopamine level. So those are the fluids in your brain that help you want to be able to taste and smell, and also allows you to for your different organs to become very functional, particularly in your brain. So when you lose your appetite, it's because your mind is so numb and so imbalanced that you're not feeling for anything, you're not thinking about that, you're just thinking about your next fix. And also, all the other organs in your body is almost dysfunctional because of the chemical imbalance. So, and the same applies when you're eating too much again. Because remember, now what am I eating? I just eat just about anything, and I eat because whatever I'm eating is making me feel good. And as long as something's making me feel good, I want more and I want more and I want more. Hence, I didn't develop an eating disorder, and I would, like you say, just eat everything out of the fridge, for example, just empty the fridge out of the cupboards out, or come into the house at 2:00 in the morning and you want to cook up a stove.
Or mainly eating a lot of sweet things, lots of sweets and chocolates and stuff like that.
Yes, remember, sweets in itself is quite a dangerous thing. If you look at sweets and the effect it has on the concentration span with kids, we've done many tests.
Yeah.
I think it's safe to say sweets or sugar is a chemical or two short of what cocaine is all about. There was an old advert that used to say sugar gives you go. Just like
cocaine. Absolutely. Okay, so we've covered cat, we've covered crystal meth, which are the two popular drugs, widely used. What else is in use, possibly in townships? I know alcohol is a story on its own. It seems young people these days are more focused on the street drugs rather than the alcohol. We've touched on weed as well. What else do we need to cover in the short time that we have left?
We're getting our youngsters now who's dwelling more into pharmaceutical drugs, sadly. Said stuff like Alzheimer's, Xanax, and Rohypnol, and various other antidepressive medications, and they're utilizing this or using this to actually get a high. But the other thing that we didn't really touch on that is quite common is what we call meowpe, which is almost like a third grade heroin, if you like. Okay, that's an opiate. So we have poppy derivatives, poppy plant, and then we have opiate derivatives, which from the opiate plant. And this is where you get your high and where you get your low, the upper and the downer. So with heroin, that's a complete downer, And then there was the old Mandrax, which is something that was also more of a downer than an upper. Okay, and that is what has caused a lot of people to be able to um, want more or different types of hives. Because remember, if we're looking at 30, 40 years ago, 20, 30 years ago, then Mandrax was the in thing. Mandrax and Daha and cannabis. There wasn't anything even more remotely more than that was really much available.
Okay. Unfortunately, we're running out of time. I've got my next interview standing by. But very quickly, just tell us how we can get hold of you. And all of these drugs that we've talked about, you would work with addicts with those types of issues. And inshallah, if they stick with the program, you are able to help them heal.
Absolutely, absolutely. So Lighthouse on the Horizon is in the western area, in the Roodepoort area, in a little township called Willow Park. And yeah, we offer various services in terms of rehabilitation. You know, we also work with depression as well, because our focus point, as I said earlier, is all about very simply family values, morals, and ethics. So we're looking at attitudinal and behavioral disorders and your actual belief system and your character. So that is a big part of our success as well. Yeah, at Lighthouse on the Horizon.
So people wanting to get hold of you can just go to your website.
Either go to our website www.jhb.co.za. You know,
Lighthouse on the Horizon.
Yeah, www.lighthousejhb.co.za.
Okay, let's just take this final question from a viewer wanting to know, why is their loved one always very, very angry, gets into a rage, almost an uncontrollable rage? What's going on there? What do they need to do about this whole horrible anger and rage?
Yes. Our viewer is really listening very carefully. This happens mainly with those closest to them. So those closest to them need to genuinely stop taking responsibility and accountability for them.
Now, I'm wondering if it's not a drug, Nazeem, is it not the effect of some of the drugs they're using?
Absolutely. It's the effect of some of the drugs. As I say, you know, if they haven't slept, they will be suffering with sleep deprivation.
Yeah.
Sleep deprivation will bring you to a point of being emotionally unstable and unavailable, and you will go into a drug-induced psychosis. So that's psychotic behavior.
Right. So it's clearly a mental health issue as well. And it's up to the loved ones, to help them get over it. But there is hope. If they stick with the program, there is hope.
Absolutely.
Nazeem, that's where we leave it. I could talk to you for hours on end. This is a scourge in our communities, and we need people like you to help heal our communities, our families, and our loved ones. Thank you indeed. Go well, and Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
That was Nazeem Abrahams, Dr. Nazeem Abrahams from the Lighthouse on the Horizon Drug Rehabilitation Center right here in Willow Park, Roodepoort. And from the feedback that I have been receiving, he runs a really tight ship. He's had lots and lots of success. So if you have a loved one in distress, then perhaps that's the place you'd like to get him or her into. 12:44 exactly. When we come back after the ad break, we're going to be talking about the cannabis industry and possibly creating jobs. Don't go away.